Hey, welcome to your visit here at Nowak Aesthetics. So I'm Dr. Nowak, and we are looking forward to seeing you here in the near future. The world has changed a little bit over the last few weeks to months, so we know that we have to change with it. Our office was initially closed to help conserve products and goods and gloves and things for people on the front line. And we're so thankful for everything that they've done to help keep us safe. And your safety is our number one concern here. So for that reason, we've modified our check-in process. So when you check in for your visit, you're going to use your cell phone and you're going to send a text message through the patient portal, or you'll give us a phone call to let us know you're here and ready. But you're going to remain in your car. That's going to be your waiting or reception area, so we keep you there, keep you safe. We'll let you know which of the staff is going to be taking care of you that day, and they'll send you a message when you're ready. You'll then meet them at our front door. They will greet you there. They'll check a quick temperature there. They'll offer you some hand sanitizer, and then we're going to take you back towards the treatment rooms. If you're in need of some of your skincare products, you can order them on the online store, and we'll have them here ready for you. So you can just grab those products. We'll take you back to the treatment room or examination room, and we'll be able to conduct your visit. As you can see, we're all going to be wearing masks, and we'll ask that you bring a mask with you, or we'll provide you one for the duration of your visit. So once we have you back at the examination treatment rooms, we'll be able to complete your visit. Everything will happen all in that room with the one provider there. We'll be able to do any treatment. We'll be able to check out with any products. We will schedule any future visits that are needed at that time. And the flow of the office, we're going to come in this way, and we'll be going out a different door. So we're going to do everything we can to keep you safe and keep you protected. This video was designed to help you understand the check-in process and everything that we're doing to help keep you safe here at Nowak Aesthetics. So we'll look forward to seeing you soon.
Hi everyone, welcome to our virtual cool event. We're going to be learning a lot of great information about CoolSculpting. We're also going to be having an opportunity to meet with Misty, my CoolSculpting rep here in our office, and also Liam, our Allergan Juvederm Voluma family rep. They're both like family members to us because we work so close with them. So I'm excited for you, all of you, to meet with them as well, and they're going to introduce more information on CoolSculpting and some of the products that we are going to be also talking about as far as fillers. So keep tuned in to learn a little bit more, and let's start by going over our agenda today. Of course, we're going to talk all about CoolSculpting with Misty, our CoolSculpting rep here in our office. And we're also going to be checking out some before and afters of our actual patients here that have been treated with CoolSculpting here at Nowak Aesthetics. We'll also have an opportunity for some questions and answers if you submit them. And then we're going to review with Liam a little more about some filler, a lot of great opportunity with filler here. And we're also going to review the specials that we have for you joining us today. And if you didn't get a chance to submit your photos, there's still time. My team and I will personally be reaching out to you as soon as the event is over so that we can address, based on your photos, what would be the perfect plan. You still have time. You can text them to 619-373-9727. This is a HIPAA compliant application, the same as our event actually. Our event is HIPAA compliant, which means it's very private. No one has access to seeing who else is here besides us, the panelists. So you can feel comfortable to share comments or questions very safely and privately. The same with the phone number. You will have, that application is called Clara. You can submit your photos of the areas that bother you the most, what you are trying to work with CoolSculpting, and we can guide you as soon as the event is over, based on the promotions, what would be the perfect package for you. So let's go ahead and get started. And we're going to introduce Dr. Nowak. Dr. Nowak is not able to join us at the moment because he is busy doing a couple of treatments right now himself. Dr. Nowak has been here in Chula Vista for over 20 years. We've been here at Nowak Aesthetics since 2007 here in East Lake, in a very, very popular area now. It's growing tremendously. Dr. Nowak is a board-certified dermatologist, and like I said, he has over 20 years of experience doing all kinds of body contouring procedures. And let's continue with a little more info. Now, I've been working here with Dr. Nowak since 2007, when we started back in our old office on 3rd and Oxford. If anyone remembers that little tiny space, we are living here or working here. Sometimes it feels like we're living, but we're working here in this amazing facility with so much more space and such beautiful facility here since 2007, like I said. So everything we've learned here with Dr. Nowak is everything that we bring to our patients. Like I said, I've been working with him for a long time. So this is our specialty, one of our specialties for body contouring, CoolSculpting. Now, for everyone that joins us today, you will be entered for an opportunity to win Botox, 3 areas of Botox. So what does that mean for us? It's where you frown, where you lift with the eyebrows, go to the forehead, and then the crow's feet area. For us, those are 3 areas. It's a value of $450, and just by attending today, you can participate to win this treatment. Additionally, with every 500 you spend, basically with every cycle that you purchase today, we'll get more into what is a cycle in a little bit here, but with every cycle that you purchase, you also have an opportunity to participate to win a Juvederm, and that is valued at $545. And right now, Liam will educate us in a bit on what exactly is Juvederm. So here at Nowak Aesthetics, we specialize in body treatments. We do all kinds of treatments, of course, anywhere from skin, face, but body treatments are one of our most daily treatments that we do here. We have what's called the 4-stage transformation protocol, and it's basically learning a little bit about everything. Sometimes it takes a combination of our procedures to reach the goals that you communicate to us that you have, where we can work anywhere from our hormone levels to balance things out to help us lose weight, all the way to non-invasive procedures such as CoolSculpting, and of course, all the way to tightening skin and even working with muscle. We have a solution for everything, and very often we will mix and match a little bit of everything to get that optimal result for you. And like we mentioned earlier, let's take an opportunity to save a spot. If you are interested in everything we present and it sounds like something that's right for you, make sure that you text us or you send a comment right now here during the Zoom presentation that you are interested in a consult, and we will personally reach out. Right now, we do have a fee for consultations, but again, because you're joining, we will be giving you a free consultation where you will meet with Dr. Nowak or Jennifer Adams, our physician assistant, and myself, and together, the 3 of us, we will be creating a plan personalized for your specific body goals. And I'm going to pass it on to my rep, Misty here, who's going to share with us a little bit about herself and also CoolSculpting.
Thank you, Diana. Hi, everyone. My name is Misty Sweatland, and I am a Senior Practice Development Manager, and I get the pleasure of working with Diana and the whole team. And I have been in medical aesthetics for nearly 20 years, and I have a Bachelor of Science from the University of Wisconsin. I used to own a medical spa in Southern Oregon, so I really understand that business side of things and the customer relationship, along with the relationship that each of you hold internally with Dr. Nowak and the team. I manage not only the practices here in San Diego, but also in Temecula Valley, and I've been with CoolSculpting for nearly 4 years, and that's why I'm very passionate about what this technology can deliver to really transform and meet your goals. So let's talk a little bit about what is CoolSculpting. So CoolSculpting really is the world's #1 way to non-invasively remove unwanted areas of opportunity, I call them, without surgery or downtime. You can get visible results after 1 treatment, and what that means is it takes on average of 20 to 25% of those fat cells out in the area each time that you go in. So when you go in to meet with Diana, she is a CoolSculpting master. It means that she has gone to a continuing education that's above and beyond what anybody else in the area has, and she's going to feel your tissue to decide what that treatment plan is going to be to give you those full correction results. And we have now been doing CoolSculpting for 10 years, so this is a little bit dated, and we've done over 8 million treatments worldwide. We can accomplish so many areas with CoolSculpting. We can do the submental area. We got our 9th clearance by doing that bilaterally. So we can treat the submandibular area. We can treat the back fat, the bra fat, the flanks, the abdomen, the arms, the banana roll, which is that pocket of tissue right below the bum, and then the inner and the outer thighs. So CoolSculpting is amazing because it really was invented to tackle those areas that are stubborn to diet and exercise. So many of us have those areas, and what happens is we use controlled cooling in those areas to freeze those fat cells to death, so that your body's lymphatic system has a chance to naturally eliminate those out. Again, you can see here on this model just other areas that we are, again, FDA cleared to treat, and it lists all of those on the right. How this all began was with a popsicle. So two Harvard-based doctors, Dr. Dieter Manstein and Rox Anderson, they looked at a study from 1970 called popsicle paniculitis. And it's where children were sucking on popsicles and they were getting fat reduction in their cheeks. And this really gave them an indication between a very simple, easy correlation between cold and fat. And they started studying this back in 1999. And then we went to market with our first device in 2009 in Canada and Europe, and then in 2010 in North America. So everybody loves food, right? Who doesn't love a good French fry? But what happens when we eat food is it gets processed in our body for energy, and the excess gets stored in our fat cells. A normal fat cell looks like the nice one at the bottom left. And then once we apply the controlled cooling, it's going to start to break down those frozen cells. And then our body has these smart little Pac-Men that come into the area to clean out those frozen dead cells so that your body can naturally eliminate those cells out. And what you can expect on treatment day is it's so amazing because you're going to get a one-on-one, a customized treatment plan to discuss what your areas of concern are, and then what that treatment plan is going to entail. And then during your treatment, what's going to happen is there's two measures to protect the targeted area, which is a pre-treatment skin wipe and a gel pad, as you're seeing on the bottom left. And then what happens is we draw the tissue up very lightly into the cooling cup, and then there's a 3D cooling cup design that's going to freeze that tissue. The applicator delivers controlled cooling, and during the experience, it's very comfortable, as you can see. You're able to sleep, you're able to read, you're able to work, you're able to watch TV, and that's because cold is a natural anesthetic, so it numbs the area, and that takes about 5 to 8 minutes, and this is why you can see people are taking selfies and laughing during the treatment, because it really is that comfortable. So with CoolSculpting, you can expect little to no downtime. We really expect you to return to whatever it was you were doing on the day of your treatment. So if that's going back to work, taking care of your family, working out, you can do all of those things. You can, again, see visible results after one treatment, but what we are in the business of doing is giving full correction results. So that may take more than just one treatment. And then, of course, just maintaining your weight, diet and exercise, can also help enhance those CoolSculpting results. And then the biggest thing is the follow-up appointments. It's so important to get your baseline photo and come in for your follow-up photo to compare that. I can't stress that enough. This is a 3-month process, so you forget where you started. And you start to see the first signs that your tissue is changing around a month, and then the final results are seen at 3 months. So make sure you keep those follow-up appointments so that Diana can help you show you how you can appreciate those results, comparing them to your baseline photo. And then we're going to talk about ALLY, which is, many of you have probably heard, Brilliant Distinctions, is rebranded as ALLY, which is short for Allergan. So this is Allergan's customer loyalty rewards program that we are very excited about. It's extremely user-friendly. If you do not have the app, please download it today. It gives you points for doing anything now, meaning that when you get CoolSculpting, or let's say that you get Botox, or if you get filler, just to give a couple of examples, we're going to give you 200 points for each of those treatments. So for each cycle, you get $20 or 200 points so that you can use that back into other areas. So let's say that your next appointment was to get Botox, you could actually accumulate money for doing CoolSculpting and then use that in your next visit. You can now also accumulate points on non-allergen products, and when you go into the app, you're going to see some of those things that you can use and accumulate points for doing other services as well.
All right.
And now I'm going to turn this back over to Diana, and she's going to go over some CoolSculpting before and afters.
Yes, thank you, Misty. So let's get started. I always say pictures speak louder than words, and it's really nice to be educated on exactly what this treatment is. But patients are always really impressed with our photos and with their own photos as well. And a lot of times when we are taking you back and getting your measurements, your weight, and your photos, it can be a little uncomfortable. So I always try to cheer up my patients and say, hey, you're gonna love it when we get an opportunity to compare these pictures of today with your follow-up. So you're absolutely right, Misty. The photos, the progress is so important for patients to see their actual results. That's always a very fun visit. So let's get started here. We're gonna start with the first before and after of an OG treatment. CoolSculpting has been around for 10 years now, and this is one of the first before and afters that were released from the marketing team. I always tell patients, this is my ultimate favorite before and after. It's not my patient, but it's someone whose story I really, really like and whose pictures I really, really like. Every time I show this picture, everyone that sees it tells me, yeah, I kind of look like that. So it's a very common abdomen. It's a very common concern that you can associate with perhaps. In this case, this before picture, we can see there's a little cushion on the lower abdomen, some on the upper, some on the love handles, even a little rimpling and dimpling across the skin. And in 8 weeks, with a treatment of CoolSculpting and the patient also losing 6 pounds. Now, CoolSculpting doesn't help us lose weight, but anything you do on top of CoolSculpting will make your results so much greater. So for a lot of patients, this is a huge incentive to make changes in your lifestyle, or maybe you're already making the changes, but you're just not seeing the difference. This is where CoolSculpting comes in and lets you see that result that you're working so hard for. Just like in this case, we can see the results are really, really impressive. Like I said, this is my favorite before and afters, the OG before and after of CoolSculpting, where it looks like even she had more than CoolSculpting, but that's all she did, and just make some adjustments in her life to lose 6 pounds in 8 weeks. And for me, this is one of my favorite combinations of CoolSculpting and making better choices. Really gives you the best ultimate result. Now, these are some of our actual patients, and as you see, we have a before and after, but on the bottom, we also have the treatment plan. And this is for you to get a visual of exactly what was treated, how was it treated. Again, it's all about visuals. In this case, with the before, we treated right below the little bra area, that tiny little pocket that she was starting to get. We treated her middle abdomen and also the lower abdomen right around the belly button area. And in 3 months, we're able to really, really flatten that area. This patient is actually a nurse. She's super young, as you can tell by her beautiful skin. She's very young, but no matter what, she just doesn't have the time and sometimes the energy to go that extra mile and work out in between her shifts. She's a nurse, she works at night, and sometimes it's 12-hour shifts. So for her, this really gave her that jump to take it from there. Just keep working at it, maybe with food. If we can't do it with activity, then we compensate with food. It's all about finding a balance. In this case, this is another great and popular treatment. We treat our abdomen and we also treat the love handles. Our goal, again, treatment to completion there. We're treating the lower abdomen, in this case, the upper abdomen and the love handles. And when it comes to the love handles, you can see that we overlap the applicators. Our goal is curves, or your natural, beautiful curves. We don't want to make anyone a square. We want shape and contour. And this is where it comes to making sure you find the right person that knows how to find that nice contour for you. And in this case, we can see her afters are pretty darn impressive. Even her skin looks better, right? In this case, this is another patient who's a mom of 3 little ones, back-to-back little ones that she, no matter how much she does, and how much time she dedicates to, the little bit of time she dedicates to herself, she just wasn't getting back onto where she wants to see her abdomen in. And we can see with a treatment, we were able to treat the lower abdomen, the upper abdomen, and also her flank or love handle area. And we can see how nicely everything resulted here. We were able to flatten her abdomen. Again, her skin even looks better. And not in this particular case, but in another angle, we can even now see a little bit of her C-section incision that was tucked under that little pooch that very often we develop after babies. In this case, this is another patient who took it an extra mile. She lost about, I want to say, 7 pounds within 3 months. And this is a great combination with CoolSculpting. She's able to make some adjustments. We were really able to reduce that roundness on her abdomen. In fact, this patient would be a great candidate to retreat. In her case, she said, you know, Diana, I feel like this really helped me. I'm fitting better in my clothes. Let me keep working on myself. And if I feel that I'm stuck, I know where to find you again. So it's all about what you're looking for. And if you're happy with what we get out of 1 or 2 sessions, that's all it takes. Another mom busy with 3 little ones too. In this case, we treated her flanks area right below that little bra fat, the waist area, the middle of the back. And in just 3 months, we were able to really soften up those creases that were right under the bra fat. If you see the roundness on the right side, how much we were able to flatten that and bring back those natural curves. The funny thing is that when this patient came in for her follow-up, before we even looked at the photo, she said, Diana, I don't think we're going to see a difference. I wasn't able to exercise at all. So I said, well, you know, let's see what we got. We took the pictures, we compared them, and she was blown away. I was too, and I said, can you imagine how much better it would have looked if you had made those little adjustments and made a little time to work out? So there's always room to improve with CoolSculpting and even after CoolSculpting. Thighs don't stay behind. We treated, in this case, our patient on the inner thighs. We did 2 sessions. Clinically, it is safe to retreat any patient in the same spot as long as there is something to treat within 4 weeks. So in her case, we treated with CoolSculpting, then retreated in 4 weeks again. And this, her follow-up is in 3 months. We can see we have a little more space in between that thigh, less rubbing together. So who doesn't want to work with that spot? The arms are another very popular area as well. A lot of our patients tell me, I can't wear anything sleeveless because I just hate this area. And this is a very popular treatment. And what's best is because CoolSculpting is non-invasive, there will be no marks, no scars, nothing left behind to where no one can tell what you had done. You're just going to look great. And in this case, our patient also had 2 sessions. Again, they're 4 weeks apart. And in 3 months, we were able to really reduce that little pocket weighing down on the arms. Her skin bounced back very nicely. Guys do CoolSculpting all the time as well. In this case, our patient treated his upper abdomen, his lower abdomen, love handles, and off-label, we treat the chest very safely here. As long as there's cushion and fat, of course, and every time you come in, you will always be meeting with Dr. Nowak and Jenny to confirm, okay, this is really a good spot to work on. In this case, our gentleman patient treated all 8 areas with CoolSculpting, and he had amazing results. We can see how flattened his chest is, less of those curves on the love handle. He actually came back a second round to work on the lower abdomen because he wanted to take it even further. Then he moved to Utah, and I didn't see his afters. In this case, this is a super young patient. He's actually a tattoo artist, and this happened this year with COVID. He was planning a trip. He booked a trip to Japan for some, I think he got hired, or he was going to be part of a big tattoo, I don't know, convention, something like that. So because COVID hit, he actually had to cancel everything. He got a lot of his money back, which was a good thing, and he decided to invest on himself. So he treated with CoolSculpting his abdomen twice. He treated the upper and lower, and in through 6 weeks, he was really already making a huge progress. We can see how much of that roundness had gone down, and he just looked amazing. So I hope this made up for missing the Japan trip. The Cool Mini is another super popular treatment. Cool Mini has been around since 2015. It was one of the last applicators that came out with CoolSculpting, and we use it very, very popularly on the chin area. But other areas where we can play with it is the bra fat, around the knees, and any smaller pocket around your body. And we can see in these before and afters, in a matter of weeks, we can start seeing a difference there. This is our actual patient. He actually came in twice to do a treatment in the submental area. We treated him, and in 4 weeks, when he came back to do the second session, there was already a really nice progress. And I said, hey, check out how much already has gone down. He was amazed, and he was excited to add that second session to see how much further it would even go. So in 3 months, we followed him up after his second round, and that was a very, very significant reduction. Before the Cool Mini, the only way to get rid of the fat here was with liposuction. So now we can avoid that surgery approach and treat with CoolSculpting in a non-invasive way. This is another of our favorite before and afters. This is Elsa. She treated the submental area, and she also added old therapy. Now, very often we have so many tools in our office that we can mix and match to target different things. With CoolSculpting, we were able to target and reduce the pinch. And with old therapy, we were able to tighten and lift the skin. Old therapy is FDA cleared for lifting and tightening skin. So together, Cool Mini and old therapy are BFFs. They work really, really good in reaching those results. Now, these next few things are what make our office unique when it comes to CoolSculpting. And this is what we do to secure your results, to make sure that we give it all we got in every single application that we put on, whether it's the chin, the arms, any spot. We give it all we got in every single treatment. And this is why we use the C-Wave instead of using a hand massage. We used to do the hand massage when we barely got CoolSculpting back in 2011, but in a few years after, we learned that the C-Wave was an option. So C-Wave is to replace for us the hand massage. This is a device that a cousin of it was used in the 80s to break down kidney stones. We're not using it to break down kidney stones. In our case, we're using it to injure more fat cells. So this is a bit silly, but this is how I love to present it to patients. Let's pretend that with CoolSculpting, we froze our fat cell to turn to like a rock. That C-Wave massage for us is going to turn that rock to pebbles. And that's how your body has an easier time breaking things down. It's also introducing a lymphatic massage. So this is our way to really make sure we're getting as much as we can out of those little frozen cells that we just treated with CoolSculpting. Additionally, at home, we'll be working with a product called Transform, another backup there to make sure we get the most out of CoolSculpting. So as soon as we're done with our treatment, we've massaged everything, we clean you up, we will be applying a product called Transform. This product is not necessarily medicine. It's actually safe enough for a pregnant woman to use, which is rare for some products, but this one is very, very safe. But in our case, we're using it to get more of those fat cells drawn out of your body. We put the product on topically like a moisturizer twice a day, every day until we finish it. We use it on every single spot we treat it with CoolSculpting. What it'll do is gonna get absorbed down through the hair follicles, and it's gonna reach the molecular level where CoolSculpting happened, where the damage happened. It's going to get your immune system like a magnet attracted to that area, and it's gonna influence your body to get rid of it more thoroughly, more aggressively. So again, in return, we're just speeding up the result. We're taking those fat cells further. We're also eliminating any little dead collagen we might have in the way to make room for new skin to grow. In fact, this product by itself can improve the quality of skin 68%. But in our case with CoolSculpting, we're just taking that result even further. If you see there the image, there's lots of these images, lots of clinical images to really indicate and prove that this treatment does really take that result further. Where we use the product, we get such a greater reduction of fat than where it's just simple CoolSculpting alone. I always love to share my results. These are a little vintage now because my before is when my son was 1.5. Now he's 10 years old. And since this day, I became a true loyal believer in CoolSculpting because I saw it on myself and I see it every day on our patients. So Dr. Nowak treated me with CoolSculpting. He treated my lower abdomen, my upper abdomen, and my love handles. A month after the treatment, we took some pictures to monitor the progress, and I was like, it's okay. I wasn't really impressed. I had been doing so much Zumba because I'm not super athletic. So I was doing Zumba and any gym workout that I could do. I lost the weight I wanted to lose, but that area just wasn't bulging. So when Dr. Nowak treated me in a month, I was like, okay, it's okay. In 3 months, when I finally reached my result, because remember, CoolSculpting takes full effect in 3 to 4 months. I was like, whoa, now I see the difference. And now I see my dedication to it and all that time I spent at the gym. So I was really, really thrilled with the results. My skin got so much better as well. No doubt the volume went down, and I think I've done a pretty good job of maintaining it. And I love what CoolSculpting has done. So I think you will too. Now we're gonna pass it on to Liam. He's gonna talk to us a little more about what the Juvederm family has, and pay attention because this you could win one of these.
Thank you, Diana. Wow, it's tough to follow or to go after you with all your passion for CoolSculpting and being one of our master practitioners. It's just so evident your passion for the actual procedure and the actual outcomes you help your patients achieve. So thank you so much for sharing with us all that. So I'm going to share my screen and kind of transition from the body to the face at this point with some of the other tools that are available through the amazing practitioners like Diana at Nowak Aesthetics. And it's awesome to hear her speak to it and to understand the comprehensive approach that they utilize to achieve really the best possible outcome for you, depending on what your primary desires and goals are for being treated when you walk through the door. And one of the tools in their toolbox is the Juvederm collection of fillers, also available from Allergan. So within the Allergan aesthetic family, we're the manufacturer, right? We have body contouring solutions like CoolSculpting, and then we have facial injectable solutions like Botox Cosmetic, which I'm sure many of you are familiar with, the Juvederm family of fillers, which includes Voluma, which we'll review today, Kybella, which is another adjunct therapy that actually helps to melt fat, in particular in the submental area, where you can also get treated with the CoolSculpting Mini, which is fantastic. And we also have Skin Medica. All of these solutions, and Skin Medica is our medical grade topical skincare line, they're all offered at Nowak Aesthetics to contribute to your overall solution. So normally the urging we, or the recommendations we provide are to go and get a consultation from Diana, from Dr. Nowak, or from Jennifer, to really talk to them and get into that conversation about what are your overall aesthetic goals, because you can really achieve them there at Nowak Aesthetics. So we're thrilled to be partnered with them. But on the screen now, you'll see one of the 5 current hyaluronic acid-based fillers within the Juvederm collection of fillers. And I'm going to try and keep it very high level because hyaluronic acid sounds complicated, right? But it's actually a molecule that exists within our skin, in our bones, within soft tissue, all over our body, and it plays an important role in providing youthful look and appearance. Unfortunately, as we age, in particular, it starts in our mid-20s, we start losing the quantities of HA that we had in our skin when we were younger, and that tends to taper off more and more as we age, right? So we need to replace it in order to rejuvenate our look, our aesthetic look, to look like we want to look whether we were 10 or 15 years prior, right? When we were very confident in ourselves. So that's what these products help achieve, but in particular, Juvederm Voluma, in this case, now the #1 filler in the United States, as well as internationally. Why? Because it provides different solutions in different parts of the face to rejuvenate and restore lost volume. So I'll go through kind of what that looks like. So as I mentioned, being the #1 now chosen filler, it is now FDA approved not only for mid-face augmentation or loss of hyaluronic acid and volume in that mid-face due to several factors, but now also in the chin. So it's really a product that can help kind of reconstruct and recreate youthful look and appearance in the face overall. There's a very high percentage of satisfaction with this product. Allergan is one of the only companies that actually measures patient satisfaction in our clinical trials, as well as how much product patients will need at retreatment. Unlike CoolSculpting, right, typically where you get permanent elimination of those fat cells through Diana's expertise and ability to consult with you and provide that outcome. With fillers, the outcomes are typically, they're temporary in terms of the duration, right? So eventually the products wear off and we metabolize them and they go out of our body. Juvederm Voluma is the longest lasting hyaluronic acid-based filler in the United States, with outcomes lasting up to 24 months in the areas where it's used to treat. So because of that, there is a very high satisfaction. Not only does it restore youthful look and appearance, but it also lasts considerably longer than other solutions out there, which is why practitioners like Dr. Nowak and Jennifer use it in their approach to treatment. And what I would urge you to do right now is, if you want to learn more, right, they provide several different approaches to utilizing. Juvederm Voluma is a tool that they utilize to provide and give you that beautiful youthful look and appearance. And they have three primary approaches they utilize in their triangle lift, their 5-point profile, as well as their combination contour, which really they've created, and no one else really does the way they do at Nowak Aesthetics to provide the outcome you're looking for. So I urge you, again, call, set up a consultation if it's something you're interested in, because you're going to be able to learn more about the opportunity to rejuvenate your youthful look and appearance. And now I'll just show you some before and afters. Like Diana said, pictures speak 1,000 words, right? It's much better to look and see what type of outcome you can achieve versus me just telling you about the science behind the products. It's important, but for you all, it's more about, okay, how am I going to look? And am I going to get that value and beautiful outward look and appearance that I'm hoping to achieve? So in particular, we're looking at the chin here for Ashley, a younger patient in her early 30s. And you'll notice she has a little bit of recession of the chin. So what's so exciting about the chin area is right now, there's not a ton of treatment in that area overall within the industry with fillers. It's just not an area that's been widely studied and approached. So to give you an example, Voluma came into the market in 2013. And at that time, there weren't any products that were approved by the FDA to augment the cheek area and kind of give you that beautiful 2-finger lift, we call it, in the mid-face to restore some of the youthful look and appearance. And at that time, there was only about little less than 1 in 4 patients who were even treated in the mid-face. Because of the new indication, the ability to use Voluma and it coming to market, it's now closer to 50% of patients being treated in the mid-face first versus other places in the face with filler. The same will happen with chin, except now there's less than 10% of patients being treated in the chin area. And you can see from Ashley's before and afters, just a slight projection and correction of that chin to restore the symmetry, that vertical symmetry from the bridge of her nose to the apex of her chin provides a beautiful look and appearance. And what we expect to happen is, with this education of to the marketplace, to you all as patients and to providers, that chin in combination with mid-face treatment will help to restore youthful look and appearance, restructure part of the jawline, and again, make you look and feel more confident, youthful, and vibrant. Here's the beauty of going to Nowak Aesthetics. They've already been treating these areas for quite a long time. They have a high level of expertise in treating these areas with products like Voluma to get you that outcome. Moving further along now to somebody like Avi, who's been treated in both the cheeks, the mid-face with Voluma, as well as restructuring that chin, widening it slightly, as well as projecting it slightly. You'll notice how great her outcome looks. She's approaching her 40s. She was someone who's on TV, who's in the public eye quite often. She was thrilled with her outcome. She was actually treated here locally in Southern California. Then Victoria's outcome, which I love. It's so impressive. It almost looks like when you combine both the mid-face approach to treatment with Voluma as well as the chin, it looks like she almost got a little bit of fat reduction done in her submental area, this area underneath the chin. And she actually didn't. It's just restructuring the bone there, almost is what we call it, because the product is put primarily down on top of the bone to provide just that subtle correction. And it looks like other faces of the or other parts or maybe concerns of the face also improve because of that restructuring. Ellie's I also love. Incredible. They look like two different people, right? If you look at her before and after, it could be an older sister and a younger sister, right? She looks fantastic. Again, you'll notice in her profile, because of the chin projection, as well as the cheek projection that's achieved through utilizing Juvederm Voluma, some other areas of the face improve, including these nasolabial folds that we get as we age, as well as some improvement in that area underneath the chin. Imagine the outcome that can be achieved with the expertise Diana has with utilizing the CoolSculpting Mini in addition to a filler treatment, right? It could be amazing. Dylan's, I particularly love being a man, as Diana said as well. Men get CoolSculpting, but they also get filler. And we think the chin area now with education and how to remasculize the chin, that more men will be interested in getting filler. In fact, my younger brother, younger now, I'm aging myself, he's 40 years old, just got treated in both the chin and the mid face. I wish I could show his before and afters, but they look very similar to Dylan's. And Dylan being a Marine Corps veteran, he was always kind of told, anecdotally, I know this story, that he had kind of a feminine looking lower face. They were able to provide more projection, actually widen the chin as well for him, to then give him a more masculine look to his lower face. Really, really impressive outcomes. So to sum it up on my side, why is Juvederm Voluma the #1 chosen filler in the United States when we talk to practitioners? Well, because it has so many different properties that allow it to be utilized in different parts of the face, in this case the mid face as well as the lower face in the jaw chin area, to provide more structural integrity as well as lift capacity to improve the overall youthful look and appearance of the face. So at this point, I thank you for your time. I'm going to turn it back over to Misty and to Diana. So I will stop sharing. All right. Thank you, Diana, for the time.
Thank you. Okay, so we are going to review a little bit more about our current situation with COVID. So, as you might have seen through our social media, our office here at Nowak Aesthetics is PurpleStrong. And as we have reached the purple tier, we have taken extra measures, which we have already done since the very beginning of all the situation that unfortunately we are all going through. We do our best to make sure that every single patient that walks in our offices feels safe and is safe, as well as our own team members, because we all have little ones and family to go to. So we want to make sure that you feel totally comfortable when you schedule your treatment, your consult, or any visit with us. And how we do this is we plan ahead. As I mentioned, the Clara system is a really great way for us to communicate with you. The numbers that you can text with questions, with photos, whatever it is, it's 619-373-9727. And when you arrive, you can actually text us, I'm here, while you're in your car. You will have a nurse assigned to you that day, so she will text you as soon as she's good for you. Okay, come on in. She'll open the door because we actually keep it locked. We'll check your temperature. We'll give you hand sanitizer, walk you straight to the treatment where you will only be seeing your provider. In the case with CoolSculpting, I will be with you the entire time from the minute you walk in to the minute you walk out. As the treatment is happening, you will be alone, but we have a really cool little help button that you click if you need me, and it'll buzz me and I will be there immediately because you are the only patient that we will be working with. We ask everyone to wear a mask, of course. We are always wearing our masks. Again, we text throughout our visits. If you're here, if you need anything else, you can always call us or text us or email us, of course. And hand sanitizers are available everywhere. But like I said, our office is super committed to being PurpleStrong. In fact, every day, our team from the front calls every patient on the schedule and will personally screen them over the phone, asking them the questions if we have any symptoms, this or that. We are pushing every person here in our office to keep, and we are all doing our best to make sure that everyone comes in nice and safe and leaves nice and safe as well. Now, because you participated in our event today, you get to enjoy some special event pricing. So for CoolSculpting, we have buy one and get the second one 50% off. That's a pretty good, cool deal. We have financing available as low as $187 a month if you qualify with Care Credit. We also have our most popular normal package that we commonly sell is 6 cycles. 6 cycles means 6 areas. And as we review some before and afters, with 6 areas, you can treat your entire abdomen or abdomen and waist, arms and bra fat. You can mix and match as long as we have enough to cover everything, but it can be as low as $239 a month. Now, for members, we have memberships with Hello Bright Eyes, Beauty Booster, and our Body Booster membership. You get an additional 30% off on top of the buy one, get one 50% off. So members, you get all the goods. The most popular package, like I was saying, is 6 areas, but a lot of patients decide to upgrade that to what we call a signature look, the Signa Curves. That includes 6 areas of CoolSculpting, 6 areas of the C-Wave massage, 4 sessions of M-Sculpt, which would target the abdomen, and then the Transform product, which is, again, taking that result further, applying it topically to all the areas where we do CoolSculpting or M-Sculpt. And the big bonus is that you get to treat your buttocks for free, the same visit as your abdomen. So in the abdomen, we're strengthening and tightening that core muscle. And the buttocks, we're just plumping out that muscle to look a little rounder. Now, a lot of our patients finance, and that is totally fine. We are actually top account for Care Credit because we work with normal average patients, moms, dads, everyone that works, and we work really hard to earn our money, and sometimes we don't have quite enough to get everything we really want. So very often our patients will apply for Care Credit. It's a super easy way to sign up and see if you qualify. It really literally takes like 60 seconds to get a yes or no. And how you know exactly how much you need is, again, through either a virtual consultation or an in-person consult, and we can walk you through the process of Care Credit. Now, we're going to wrap it up here today. And again, thank you everyone who participated and joined us. And we will be personally reaching out to all our attendees today and making sure that we've answered your questions. And if you think you are interested in either getting started or learning a bit more, we can go on from there. We can meet with Dr. Nowak or Jennifer Adams, whoever's available first, and go from there. So thank you so much for joining us. Again, please submit any questions or